Women and men hoping to start a family for good reason are interested in the types of foods that can help to increase their fertility health. And I'm going to provide a few suggestions. This is certainly not a comprehensive list, and I always recommend running any shifts in your diet by your medical care provider. And I also want to note, if you're a woman watching this and you are with a man, it's equally important for him to have a really healthy diet as well, because his diet impacts his sperm health. And we have this misconception that any fertility issues or difficulty getting pregnant is the woman's fault, but almost half the time it's related to male infertility issues. So go ahead, if you're with a male partner, have them do this as well. Okay, so eating plant proteins. So plants with an abundance of proteins can really support fertility health by aiding in the repair of tissues and the creation and release of certain hormones, enzymes, and blood cells. So a couple of plant or protein-rich plants include beans, peas, and nuts. There's so many additional ones too. Eating healthy carbs. So foods containing carbohydrates that the body slowly digests can enhance fertility by helping to regulate your blood sugar and insulin levels. And you can find these slow carbs in foods like whole grains, beans, whole fruits, and vegetables. Something like sweet potatoes is really great for this. You can also promote your fertility with iron-rich foods like spinach, beets, tomatoes, pumpkin. All of those are rich in iron. Full-fat dairy. If you don't have dairy intolerance, you can support your reproductive health by eating full-fat dairy products like yogurt. Yogurt's great because it can also help with your digestive system. Certain fats, so you can increase the body's sensitivity to insulin and reduce inflammation by eating foods high in healthy fats like avocados, eggs, fatty fish, especially like salmon. We want to stay away from fish high in mercury. Chia seeds and nuts are also great for getting in those healthy fats. And you can also talk to your doctor about taking a fish oil supplement. Taking a multivitamin is also really helpful, especially prenatal vitamins with at least 400 micrograms of folic acid. This is really important for women because already having that folic acid or plenty of folic acid in your system helps to prevent brain and or abnormalities in the brain and spine of the developing fetus. So that's one of the most important things you can do, is take a prenatal vitamin with at least 400 micrograms of folic acid. And of course, you want to stay away from all cigarettes, like totally quit smoking. And with alcohol, you don't have to absolutely cut it out, but your care provider will likely recommend cutting back to just maybe a couple glasses of wine per week. Stay away from recreational drugs. And with prescription medications, talk to your care provider. Let them know that you and your partner are trying to become pregnant. Let them know, what prescription drugs you're on. They'll probably already know because they probably prescribed them. They might say, yep, you're totally fine to keep taking them as is. They might adjust your dosage. They might recommend a different medication to treat the same issue, but that medication might have less adverse effects during pregnancy. So anyways, check with your doctor about any medications you take or any other supplements. And in addition to shifting your diet, you want to make sure you're getting at least about 30 minutes of moderate exercise daily, if you can, at least 5 days a week though, managing your stress through those classic, options of meditation, deep breathing, journaling, a therapist if you can swing it. I am a big supporter of therapy for everybody. And then when you're seeing your doctor, ask them if you can have a physical, a pap smear if you're due for one, and a blood test if you want to test your reproductive hormones to just see where they're at. So that's really just a starter list of things that you can do to prepare for pregnancy. So let me know if you have any additional suggestions or any questions about anything that I mentioned in the comments below.